Let me ask you a very honest question. Do you feel knee pain when you stand up from sitting? Do you wake up with stiffness in your knees? Does climbing stairs feel harder than it used to? Or does the pain get worse at the end of the day? Now, if you answered yes, I want to reassure you of something very important. Not every knee pain means surgery, and not every case of knee osteoarthritis requires lifelong painkillers. In fact, the majority of people suffering from knee osteoarthritis can significantly reduce pain, they can improve movement, and protect their knees by using simple, daily steps at home, but only if they understand the problem correctly. Now, let me be clear. This video is not about quick fixes. There is no magic cure here. But what I will give you is a clear, step-by-step plan. A plan that shows you exactly why your knee hurts, what makes it worse, what actually helps, what to do every single day, and when you should worry and when you shouldn't. So, if you suffer from knee osteoarthritis, or if you have early knee pain and you want to prevent it from getting worse, I strongly recommend you watch this video until the end, because every part of it matters. Welcome to Dr.PureHealth, where understanding always comes before treatment. Now let's start with the basics. Knee osteoarthritis is a condition where the protective cartilage between the bones of the knee joint slowly wears down. This cartilage normally acts as a cushion. It absorbs shock and allows smooth, painless movement. But when this cartilage becomes weaker, friction increases, inflammation develops, pain appears, stiffness follows, and movement becomes limited. But here is the key point most people do not understand. Pain is not caused by cartilage loss alone. Pain is mainly driven by inflammation, excess pressure, muscle weakness, poor movement habits, and lifestyle factors. And that is actually good news, because these are things we can control. This condition affects both men and women. Women are more affected after the age of 40. Men are often affected due to physical stress or previous injuries. The causes may differ, but the treatment principles are the same. Painkillers may reduce pain temporarily, but they do not fix the root cause. They simply silence the warning signal. And over time, excessive use can harm the stomach, the kidneys, and overall health. So now, let's talk about real solutions. Step 1. Understand pain. Pain is not your enemy. Pain is a message telling you to reduce overload and inflammation. Complete rest is one of the biggest mistakes. A joint that does not move becomes stiff and weaker. Use heat when stiffness is dominant. Apply a warm compress for 15 minutes before movement. Use cold when swelling or inflammation is present. Apply a cold pack for 10 to 15 minutes after activity. And never apply ice directly to the skin. Step 2. Movement is medicine, but only when done correctly. Walking on flat surfaces with supportive shoes for 10 to 20 minutes, 4 to 5 days a week is one of the best therapies for knee health. Avoid running, avoid excessive stairs, and avoid steep slopes. Step 3. Strengthening exercises. This is the foundation of recovery. Always move slowly. Never push through sharp pain. Remember, consistency matters more than intensity. Straight leg raises. Lie on your back, one knee bent, the other straight. Lift the straight leg slowly. Hold for 5 seconds. Lower gently. Repeat 10 times, twice daily. Quadriceps tightening. Tighten the thigh muscles. Press the knee downward. Hold for 5 to 7 seconds. Repeat
10 to 15 times. Gentle stretching of the back thigh muscles reduces tension and joint stress. Step 4. Body weight matters. Every extra kilogram adds pressure to the knee joint. Even a 5% weight reduction can dramatically reduce pain. Step 5. Anti-inflammatory nutrition. Reduce sugar, processed foods, and refined carbohydrates. Increase vegetables, healthy fats, fish, and water intake. Remember, cartilage depends on hydration. Step 6. Sitting and sleeping posture. Avoid sitting for long periods. Change position every 30 to 40 minutes. Use a pillow between or under the knees during sleep. Step 7. Knee support. Elastic knee braces can help during walking, but they should not be worn all day because prolonged use can lead to muscle weakness. Improvement takes time. After 2 weeks, pain usually decreases. After a month, movement improves. After 3 months, real change happens. Seek medical attention if there is severe swelling, joint locking, inability to walk, or a sudden injury. And finally, knee osteoarthritis is not the end of your life. With understanding, consistency, and correct habits, you can regain control and move with confidence again. This is Dr. Pure Health, because understanding always comes before treatment.